Hello everyone, my name is Spandana Pasupaleti and today I will be presenting a literature review exploring whether implementing a care bundle can reduce intraventricular hemorrhage in preterm infants. Preterm infants are those who were born before 30 weeks of gestation or high risk of developing intraventricular hemorrhage. The global incidence of intraventricular hemorrhage in this group is around 20 to 25%. It usually originates in the fragile germinal matrix due to the immature blood vessel, impaired cerebral flow, and oxygen fluctuations. IVH is usually classified into four grades, grade 3 and grade 4 being severely linked to long-term outcomes such as cerebral palsy, hydrocephalus, and cognitive disability. Since there is no definitive cure exists, prevention through neonatal care is crucial. With the keywords preterm, care bundle, neuroprotective and intraventricular hemorrhage, a search was run in Google Scholar and Embase. Out of many papers in our search, we have narrowed down using a care bundle and intraventricular hemorrhage as further filters. The search was limited to humans and English language. Finally, I have narrowed down to 3 studies as they were most relevant and were of high level in the evidence pyramid. As per PICO classification, the population involved in all the 3 papers, the first paper, Mohammed E. et al., where the systemic review was done and the preterm infants weighing less than 1500 grams and babies delivered between 24 to 36 weeks gestation were studies. And the study population for Christina Wall et al. Were less than 32 weeks of gestation. And the studies done by the Prashant et al., the preterm less than 29 weeks were included. In intervention, in all the 3 studies, the elements of care bundle I have summarized in the table below. As per Mohammed E. et al. Study, delayed cord clamping, minimal handling in the first 72 hours, midline head position, head of bend elevation, normothermia and normoxia maintenance were included in the care bundle plan. As per Prashant et al. Study, delivery room stabilization, early CPAP, thermoregulation, minimized handling and reposition, optimized ventilation and oxygenation targets are used for care bundle implementation. As per Christina Wall et al., avoidance of rapid volume expansion, minimal endotracheal suction, strict glycemic and BP monitoring, midline head position are the elements included in the care bundle. In Christina Wall et al. Study, preterms who were treated before 2011 were studied retrospectively and were compared with the babies admitted after 2011 prospectively after implementing the care bundle. In Prashant et al. Study, infants were assessed pre and post implementation of care bundle 2. In the systemic review done by Mohammed E. et al., 2 papers demonstrated reduction in the incidence of IVH, but the mention of control groups were not made. The outcome reviewed here is intraventricular hemorrhage. As per literature review, the study done by Mohammed E. et al., there was evidence supports using a standardized care bundle to reduce intraventricular hemorrhage in a very low birth weight infants, and the studies done by Smith, Kubica and L. Atavi showed reduced IVH rates with the bundle intervention, mainly using midline head position, minimal handling, delayed cord clamping and thermal care. There was a systemic reviews confirmed that maternal chorioamnitis, poor ventilation, rapid fluid boluses are the modifiable risk factors, and meta-analysis showed delayed cord clamping also reduces the IVH by 17%. These are the elements discussed in the Mohammed E. et al. Paper. A study done by Wall et al. Demonstrated that implementing a care bundle including neutral head position, delayed CSF collection, and improved thermoregulation has significantly reduced the incidence of IVH during the hospitalization and grade 3, grade 4 hemorrhages. In a quality improvement project published by Prashant E. et al., established that delayed cord clamping reduces the IVH rate by 95% with the confidence interval and mortality also. Fluctuations in the CO2 level greater than 15 of Hg increases the IVH risk. Thus, permissive hypercapnia is advised. After implementation of the care bundle, inotrope use dropped from 23.6% to 6.9%, opioids from 18.9% to 6.9%, hypocapnia from 43.9% to 34.6%. Minimal handling reduces the cerebral instability and sedation needs. Standardized care with the delayed cord clamping, gentle ventilation, early nutrition improves the outcome. I have summarized all the 3 studies in the table form with their sample sizes and what are the key findings of the study. As per conclusion, there is a robust evidence including systemic reviews that implementation of care bundle has significant effect in reducing the IVH. Despite there is a lack of standardized approach in reducing IVH among preterm infants. There is an ongoing need for staff training and multidisciplinary approach in implementing such care bundles. Furthermore, research and more QI projects must be done in identifying single most effective measure in preventing IVH. Thank you.